So from the latest update that we had, which they update on a weekly basis, Sacramento County had a case rate of 9.5 per 100,000. We are still in the purple tier, which is the most restrictive. In order to get to the next tier, we have to get to 7 per 100,000. So we're very close, not quite there yet. The positivity is at 3.8 positivity, so it's come down a lot compared to where it was at the end of 2020. So we've definitely turned the corner. We're past the peak. And so now our efforts are focused on the vaccination. So with that, I'd like to turn it over to Mike to talk more about some of the efforts we have in the community for vaccination.
So what are the requirements, right? Where we're at in terms, again, we follow the California Department of Public Health tiers, and how it has been allocated and rolled out is based on professions. So we kind of follow these particular guidelines to kind of allocate and roll out vaccines. No medical insurance is required, right? For those that are concerned. I know that some questions were brought up about how about undocumented individuals and whatnot. We are asking for a form of ID just to verify, because the concern that we have is that some vaccines have a 2-dose process, and we want to ensure that there's a continuity and people could come back to get access to that. So this is why a process in which we verify. And at this point, any vaccine is a good vaccine. There's a lot of misinformation, and there's a lot of layers. Not only do we talk about how do we provide vaccines equitably, but how do we also combat misinformation and align some of the communication to build trust among community members, especially Black, Brown, Indigenous, and communities of color.
I think I have a lot of hope and also a lot of worry about where we are today. The hope piece is that Native people, we have a feeling of shared or collective responsibility for each other in protecting our most vulnerable. So many of the young people have been very quick to get vaccinated. We have wanted to work with other communities to make sure that we're doing our part to protect other communities that are underserved or vulnerable. I have a lot of hope around the identification of health inequity for the first time, and really being able to talk openly about systematic racism and the impacts of systematic racism on our communities. And that through these community partnerships, we've really been able to strengthen the work that we do and build coalition. There are so many of us who are suffering, and I know that there's strength in this collective. So I'm quite excited about that.
What we were most surprised by is that the lack of attention to that. When something like this happens, everyone's looking at data and they're trying to find out, how do we address this? There's new information coming at, every day something's changing, right? Federal, state, county, but we kept our eyes focused on what was happening in California and what was happening in Sacramento. And we saw the rates of infection going up for Latinos. And no one seemed to be paying attention to that. I think we've learned a lot from this process. I think I echo what Britta said. The partnerships that have been established, the fact that we all have to work together, that we need to recognize, that many of us are in the same situation, and so we can leverage each other's support. I am hopeful that the narrative around immigrants will change, that we will see the value, that we will finally recognize that they have been working and they have been keeping our economies together, that we will see the value of all of our diverse communities. But I worry that that once the infection goes back, that we would go back to how things were.
A hope is like having the vaccine, and I think really coming back stronger than before. And a worry that I have is just that, our communities will continue to be ignored and left behind and invisibilized, by how things have been run in the past. And I'm just hopeful that, we come out of this stronger, and that these lessons learned really need to be put into tangible steps, into city, county budgets, so that we can continue to see our communities thrive.
What we're seeing now is that a lot of our community members are starting to speak up, and that's a good thing because Asians have been targeted for a very long time. It's just so more recent now that there is an increase, but there's also time that we're starting to come together. Now, Rachel touched up on this a little bit, and I know Dr. Casaria also said this, is that collaboration. What we saw is that more and more of us are starting to collaborate and work together and come together. And that's a good thing. That's a good thing because there was an opportunity for us to come together and address this, an opportunity that probably wouldn't have happened had this pandemic not happened, right? And that I hope that we would continue to work together and to look out for each other as well too.